The suction aspiration abortion procedure, also known as vacuum aspiration, is the most commonly used between 7 and 15 weeks from the last period. A speculum is placed in the vagina, a tenaculum is clamped to the lip of the cervix, and a cannula is inserted into the uterus. The amniotic fluid, placenta and fetus are suctioned through the cannula into a collection jar. The fetus and placenta are torn apart in the process. The uterine cavity is scraped with a curette to determine whether any significant amount of tissue remains. Blood, amniotic fluid, placental tissue and fetal parts are placed in a jar. The contents of the jar are then examined to assure that all fetal parts and an adequate amount of tissue commensurate with the estimated gestational age are present. Side effects are common and consist of abdominal cramping, pain, nausea, sweating, and feeling faint during the procedure, cramping and pain for 2 to 3 days following the procedure, as well as bleeding for up to 2 weeks. Allergic reactions to anesthesia or other medications given can occur. Bacterial infection can occur during the procedure when surgical tools enter the uterus, while symptoms won't occur for 2 to 3 days after the procedure. This happens most frequently when there is an underlying STD that is not diagnosed at the time of the abortion. Hematometra, that is, a uterine blood clot, can occur if the uterus does not contract to expel all of the lining. There will be severe abdominal cramping and nausea if this occurs. Heavy bleeding can occur if the uterus fails to contract and may lead to a uterine blood clot, as mentioned above. Heavy bleeding may require medication, a repeat abortion, surgery, and/or transfusion. A cut or torn cervix can occur when the doctor dilates the cervix, grabs the cervix with a tenaculum, or inserts the cannula into the uterus. This may lead to a weakened cervix, making carrying a future child to term difficult. The uterus may be perforated during the abortion when the doctor rubs the cannula against the walls of the uterus, causing heavy abdominal bleeding and/or infection. You may require surgery to repair the puncture, and you may need a hysterectomy to stop the bleeding. Scarring of the uterus may occur, resulting in Asherman syndrome. This scarring can occur as the doctor rubs the cannula against the walls of the uterus and can cause future fertility problems. An incomplete abortion, where the pregnancy has been terminated but the baby or other tissue does not get expelled, can occur, causing severe cramping and excessive bleeding that continues for over a week following the abortion. Emotional or psychological distress can occur after the abortion, including depression, guilt, regret, anger, and/or sleep disturbance.